Well, that's one of the very exciting aspects of this new drylands systems program, because for the first time we're thinking about scaling domains, not just pilot sites, an isolated one here and there, but dealing with the fine-scale variation in context that smallholder farmers experience, that pastoralists are experiencing. So our initial focus is a series of action sites or scaling domains. And within those, we're looking to get a proof of concept that the options that we're developing and the context that those options work in can be customized to the range of local circumstances that exist, so that we're producing solutions that are potentially relevant across the entire scaling domain. Now, each scaling domain is still only a small part of the entire global drylands. So we need not only a set of options that work in a particular scaling domain, but the means to reproduce those options and to customize them to the circumstances in a range of other scaling domains, which we achieve by working with partners who are then able to develop, using a co-learning paradigm, new sets of options that will work across the whole of the global drylands.
Are you confident it'll work?
I think it's got a great chance of working. A lot depends, of course, on the commitment, whether donors continue to support, whether we can keep at this for the sort of 10-year horizon that we have at the present time. And it also requires us to embed our research in development, and that's something we haven't been doing before, so it's a new challenge. We don't have the level of resources that are needed within research itself to try out options across a broad enough range of conditions without persuading development partners to do that, but to do it in a systematic way, so that we can monitor what works where and for whom, and then refine our understanding of what is necessary in different places. And this is really quite important, because if we don't take a systematic approach to the research on what aspects you need to have in place in order for particular options to work for particular farmers, then you waste a lot of resources, because you do things which are not necessary in particular cases. So if we're trying to improve nutrition of women and children in vulnerable dryland households, then how important is community education on balanced diets compared with making more milk available? Now, two very different interventions. Do we need both of them at the same time? If we do milk, do we also need the education? And how does that vary from different communities starting from different places and with different options and conditions? We can only understand that if we do formal trials in which we try these things out in different combinations, see what happens, and then take it forward from there.